Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Welcome, everyone. Thanks for joining us. We have a special guest with us this week, Virgil Matheny. Welcome.
Welcome.
Yes, welcome yourself. We're talking about art therapy, of which you're somewhat of a godfather / expert, certainly more than I could ever hope or achieve. So, Rich, welcome him.
Oh, hey, Virgil. I met Virgil a couple of centuries ago, right, Virg? While we both worked at the King's Youth Center in Reedley, California. And Virgil is the best art therapist I've ever met in my life. I don't know how he does what he does, but that's what we're going to find out today. So listen, my friend, how did you get started as an art therapist? Were you an artist first?
Yeah, art's been my thing. And even, your parents always tell you, no, you need to do this. You can't make a living doing that. It was still my thing. And so I started out as an artist and doing art things. And actually, when I got probably my first official job, it was a juvenile detention facility. And I was really frustrated with the bureaucracy, which as I've gotten older, I haven't gotten any better at not being frustrated with bureaucracy. But my wife actually said, well, until you find another job, you need to do something to hang on to this one. She said, why don't you relate with the kids through art? So on my lunch breaks, which were actually in the milieu, you couldn't leave, and my breaks, I would bring in some materials. And so that's what started. We were actually doing therapeutic art projects and relating with the kids that way. And so that's where it actually started. And what happened is the lunch breaks and the breaks started becoming mandatory, talking about bureaucracy. And they got longer because they realized the value to the group, to the individuals and things. And in fact, I don't know if you can see this one. This is one that you'll actually find on my website. It's a baling wire sculpture. This kid called this the hug. He was a 15-year-old that was so explosive, he just couldn't settle down. And so he had been in confinement and he was very difficult. And so I was the only person that we could talk to him through the food port. And in fact, they got very upset with me because I was spending a lot of time talking with him. And I finally said, I'm going to go in there. And it was against advice. I actually got written up for going in.
You're one of us, Virgil.
So I went in and I took in this baling wire and he sat down. And I mean, it's tough to bend. This isn't aluminum. This is tough wire. And he sat for 3.5 hours and created this thing. Well, that got people's notice because this was a kid that couldn't sit for 2 seconds without something would set him off. The irony is that 5 years later, when I was working at the penitentiary, his brother came to the penitentiary. I didn't recognize his brother, but his brother recognized me. And he said, boy, you never thought you'd see me here. I said, listen, I'm never surprised with who I see here because I saw a lot of kids that cycled through. Anyway, he said, well, my brother's not here. He's married and he's got a great job. He said, I just was so smart. I wasn't smart enough to know how stupid I was. And so here I am, and he's got a life. So that's actually where it started, where there was recognition that there were a lot of amazing things sometimes scary, wonderful, as I used to call them, would happen when the people had something that they could interact with that was nonverbal. In fact, one of my famous phrases is, sometimes words are dumb. And really, when you can't talk, every referral I've ever gotten from a psychiatrist, I knew it was an end of the line thing. They didn't know what else to do. The person wasn't talking, and so they'd send them to me. And I have some great stories, great experiences. One client that was referred was a lady from Greece, didn't know any English, and she was so depressed, but they had brought her from Greece, her daughter, so that she could be closer, and she wanted to go back to Greece, and she wasn't in a position for a lot of different reasons to go back to Greece. So she was in a facility, and the psychiatrist referred her and said, I don't know what you can do because nobody can talk to her except somebody that knows Greek. And so we started in with materials, and I still don't remember how we communicated because I didn't understand any Greek, she didn't understand any English. But as we worked together, she seemed to rebound, and she was coming around. And over about a 2-week period, it got to where she could go back home. And with that group of sessions, apparently her daughter was able to get her involved in a senior center and with some art materials and things. And anyway, as far as I know, she went on, everything was fine. My great reward from that series of sessions was that she and her daughter came back to the hospital and brought a huge tray of baklava and this little plate of baklava. And so the nurses grabbed the big tray and the little Greek lady shook her head, and her daughter explained, no, the tray is for Mr. Matheny. The plate is for the nurses. and I did share some of my tray, but that was a case where there wasn't a word uttered. And oh my God, she would do it.
How do you get started with a patient? What do you do?
Oh, well, when I start with a patient, I just I meet them where they're at. I've never met anybody I didn't like. There were personality traits that were very difficult, but you have to, you just meet them where they're at, and you try to, if they are verbal at all, you listen to what they're saying and take a cue from that and try to tie on to anything that you can. When I was at San Quentin, working at San Quentin, there was a guy that I went to see him 3 or 4 times, and he just was very angry, very loud, didn't want anybody around. And I just would go back and I'd say, I'm here again if you have anything you want to talk about, or if I've got some drawing materials, and and he'd go into a big rant and a tirade, and I'd say, well, thanks for your time, sir, and I'll be back. And then he'd scream expletives as I'd go down the tier that don't come back, don't come back. Well, it was probably the 5th or 6th visit, and he started screaming at me, I won't give you the expletives, but if you're going to keep coming back, I guess I might as well try to talk with you. And so I don't remember what he threw out what his crime had been, which, like I told you earlier, it doesn't make any difference to me. This is a life that I'm engaging, and I'm going to try to engage them on whatever level I can, the best way I can. So as he told me about his crime, and it was very heinous, probably everybody in the country has read about it or heard about it at one time. And I mean, he was in agony. He had really destroyed his life and the people closest to his life. And so he never, ever did any artwork, but he did kind of wax poetic in some very ugly terms. And so, I started engaging him about poets and poetry. And so sometimes I can't actually get them to engage in terms of what would be, quote, textbook art therapy, because one lady that I worked with, an older woman, I don't know if you're familiar with what tatting is, an art form of tatting. It's kind of like miniature crocheting. And this woman would just sit and talk and crochet these little animals and things. And it was like, and she wasn't even looking at them, but, they'd be about 2 or 3 inches big, and they were just exquisite and detailed. Well, her thing, that was her art form, and she would talk about everything coming through her mind, but it was because she was engaged with the art form. And again, the way I deal with art and therapy is people don't realize, and I know with psychologists, the house tree person, and so they're engaging people in art, and they're looking at symbols. I don't really have a symbol system that I agree with, and this is one of the places where I deviate from a lot of art therapists, because there are ones that will tell you, this symbol means this symbol means that, and I've never found any of that to be true. But where the whole issue develops is in the brain stem, and about the mind and the brain, and the brain stem is as far as lizards progressed in evolution, and so there is no bigger level or higher level of thinking and things for lizards. And with art therapy, you're actually dealing with lizard level evolution, and that's where the impetus, the motivation for the artwork actually comes from. And this is one of the reasons why, the pre-Raphaelites, the Beatles, many people did mind-altering or mood-altering things through drugs or dreams, or, whatever the methodology was. The motivation for the art in the first place comes from so deep that by the time it hits the conscious level, you can say anything you want to about what you really believe it came from, but it came from so deep, you're not in touch with it once it hits conscious level. And so that's where you introduce the materials, and the person is really, whatever they're putting out there, whatever they're saying about it, is peripheral, and it's probably concocted. I had a sociopath when I was working at the penitentiary in Iowa, and he was a part of a study that I was doing, and he said, everything's got a system, and he said, I'm going to figure it out. And he would do these drawings, and then he'd come up with these great fabrications of things, and I would tell him, oh, well, okay, and I'd take my notes. It was the fourth or fifth week that I was working with him, and he said, you SOB, he said, there is no system to this. It really is me. I can't beat this, and it's driving me crazy. Can I drop out of the study? I said, well, you can do what you want, but I said, wouldn't you really want to figure out what it is you have been fabricating and believing as your life? Rather find out what is your life. And he did continue on, and it was very interesting. The drawings didn't change that much, but the conversation did, because instead of relating to all these, he would have been a great science fiction writer. And as he said, his whole life had been fiction. he didn't know what was reality, and he'd never really taken any drugs.
So for our viewers, hang on a second. Do you sit down with them and they draw and you talk to them while they draw? Is that how it works? Or do you wait till they finish the picture and then you start talking about the different things that are in the artwork? How do you actually do it?
Well, it actually depends on the person. You remember when we were working together at Kingsview, the one client that I was referred to by the psychiatrist, she was in her mid-20s, turned out to be multiple personality, but when she was first referred to me, she was catatonic, and I went in to her room several times and there was no response. But I would talk to her just like, somebody in a coma. I knew she could hear me, and so I would leave materials, and for many days there was no response. Finally, one day I went in there and there was this little tiny picture on the paper. And so I asked some questions. She still didn't respond. So I left. And over time, the pictures got more detailed and more involved. And she did finally one day, when I walked in, she said, "Oh, it's you." And I said, "Oh, of course. Who else?" Because I knew nobody else was going in there except nurses to observe and take notes and leave. And so that was how we actually got started. And that was probably on 13th or 14th. It had been quite a while I'd been going in there. And it varies. I really don't do a lot of engagement with talking. And I think part of that is because, well, if you're quiet, there's something in people that they have to interact or they have to say something. And so I don't do a lot of talking. And during a session, if the person is talking to me and they're drawing or whatever, then that's fine. But I don't ask questions. And after they're done, we may talk if they've brought it up, but I may just take the image and put it in the chart. In fact, here, I thought about this before we got started, and this is a guy that I don't know if you can see this one very well.
Oh yeah.
Yeah.
Well, this was the first picture he did the first time we met, and he did like 4 or 5 pictures that day, and not much talking about it. And so after he had done those, it was the final session, and I think I had 8 sessions with him. And so we were going through the pictures, and I said, is this a self-portrait? And he laughed and he said, "I never would have thought of that, except that, well, when I ran away from home, I joined the circus, and they had me take care of the monkeys." And so the second session, this is interesting because of I want to show you this picture. This was the second session. He did this picture. He said, "Oh, it's just a woman. I don't know." He couldn't title it. So a week later, he does this picture. Now, if you can remember the one just before it, they're nearly identical.
Mm-hmm.
This one, he titled "A Lady from the Past." Well, anyway, he went on. We saw each other 5 more times over the weeks. And when we went back to review the pictures, we looked at the one from the second week. He says, "No, I don't know." He said, "It's just a lady from my past." So I flipped it to that next one from the next week, and he breaks down crying. I mean sobbing. Now, this was a guy that on the yard, if he walked through, the crowd parted. Now, he never said much. He had a red afro that was as big as you'd ever seen in your life. And he just sobbed for probably an hour and a half. He finally stopped. He sat up and he said, "Not a word of this goes out of here." And I said, "You don't have to worry about that." Because in fact, for these sessions at the penitentiary, we had to get a clearance clear from the governor of Iowa for me to be able to meet with them alone without a guard. Well, you know how effective a session would be if they're in there with a guard. So anyway, he started to relate. He said, "I know who that woman was." He said, "That's my girlfriend that I had tickets to Woodstock." And he said, but she was a nurse and she got the flu and it turned to pneumonia and she died. And if you remember the flu epidemic of 69,
Sure.
Which was the deadliest flu that we ever experienced in this country other than the 1918. Anyway, that was when his whole life changed. He ended up going and joining the Navy, and it got a very interesting story. Ended up in Leavenworth, and but that was something that was buried so deeply that he was in touch with it from the brainstem, and that's the impetus for the drawings. And obviously, he had some talent, so it was that closely related. But you know, I never talked much to him until we were reviewing them. And the thing with the art is that any one picture is not all that significant necessarily, but in the sequence and in relationship to other ones, it may make them very, very significant. You know, that first picture of him looking like a monkey, we didn't talk about it until almost 8 weeks later, and he started talking about his circus experiences because his final drawing was actually a circus kind of drawing. And these were things that were buried so deep, and it's really like archaeology. When you meet the person, you're in the range of something that may be very significant, but you don't know that. And even though they've worked with somebody and there may be indications of things or whatever from their perspective, I know that if you go looking for anything, you can find evidence of it. But in real archaeology, it's, you know, you start the process and it's not shovels and backhoes. It's, you know, the paintbrush and the toothbrush kind of clearing things away. And what's unfortunate is that for me, the referrals come people that have been in a lot of therapy and people that where the clinicians may have not been all that qualified or quality. And so when you get close to those things that are buried the most deeply, they've been tramped around on so that it's really hard pack. And there's the avoidance. And the sociopath I was talking about, he had been in therapy his whole life. And so he knew the words, he knew. And again, for me, it isn't about verbalization. It isn't even about particular symbols. It's the observation of the person, their reaction, their breathing, you know, what they're saying as opposed to what they're showing me. And over time, you can talk about what they're showing and it's a different evidence.
That's what I'm curious about because it's fascinating that you can get, you know, a lot of these stories are unique in that, like this, like the catatonic, no one else could reach her or get through to her, or like the sociopath, he didn't want anyone to get through and reach. At what point did you realize what you were doing was connecting in a way where all other, you know, therapeutic modalities failed? Is this something you've intuitively always known, just as well as you know your relationship to art personally? Or was that something that really surprised you as you began doing the work and learning from the patients and discovering how they get in touch with themselves and non-verbally communicate?
You know, I think since you raised it and you said it so well, it really has been an intuitive kind of thing, and probably, I guess I never thought of it in that way until you just said it, that my own art process. Um, you know, I do have a bachelor's in art, but my bachelor's didn't come until I was like 38. And so formal art training, I, growing up in my family, being involved in the arts was not something that was an identified positive. Um, you know, being in the trades, that was positive and monetarily productive. And so for me, my art was a way to interact with something that was special to me, but it wasn't necessarily something that you practiced that openly because there wasn't a lot of positives or praise. And I think that's what helps in my understanding of the connection. In the beginnings, even today, most clients, patients, art is not something that they're that familiar with. It's not something they identify with, or there's been positives in it. And so they're very reluctant usually, because they're afraid of the outcome. You know, they all want to see the masterpiece. And the whole thing with art is that the masterpiece is what you have created. I mean, if you think about it, the closest that anyone can come to being God, whatever, you know, that may be for someone, is to be a creator. And so the creation that's there, the fact that there shouldn't be any judgments, because the only thing that's right about our therapy or about art in the first place is that it exists.
Mm-hmm.
You know, and that's the representation that someone creates. The quality or whatever, that's a judgmental thing for critics, and who needs critics?
Well, that's an interesting point. So from a therapeutic perspective or potential, is connecting on that level in that way with patients more successful because they are doing the expression, the creativity, the expression of art from themselves, or is it more receiving art or interpretive, the interpretation of your art, for instance? Like, what's the balance? I'm guessing the answer is it's a little of both, but in all of the years that you've done it in the patients, which is like most important, the self-expression or being open to receive art? Or is that the same thing because I'm an art illiterate?
You know, it's all part of the same thing. And the best way I can explain it, one lady, and she was in her 60s, and God, that sounds young now, but she was referred because the psychiatrist had tried everything, and she was very verbal. But he said, I just don't know where to go with her. He said, can you see what you can find? So I started working with her, and she just talked, and about her growing up, and she had grown up in Illinois, and she'd worked for a large corporation, and blah, blah, blah. And she'd be doing these scribbles. And I mean, literally, I wouldn't need to have the drawings to show you, just loopy scribbles. And she'd be saying, oh, well, you know, this is Lassie, my dog, and blah, blah, blah. Or this was my home in Palatine, Illinois. And so the next time we'd get together, and she'd start in again, scribble. And so I saved all these different scribbles. I couldn't tell one from another, but always on the back. And that's an important thing for me. many art therapists will identify on the front a name of things or what the patient has said, and that's another story for another time. But anyway, so this lady, when we'd look at those scribbles, she'd say, "Oh yeah, that's my Lassie. Oh, that's my house in Illinois. Don't you remember?" And so she could remember all that. And so at the next meeting that we had with the staff, clinical staff, he said, "What did you find?" And I think he actually was kind of being vicious in asking. And I said, "Well," I said, "I think you need to do a CAT scan, and you're going to find that there's deterioration in the left hemisphere." And so he started laughing, and everybody started laughing. And I thought, well, okay, fine. You asked me, that's what it is. He came back to the next session and he said, "My God," he said, "it was amazing." He said, "We did a CAT scan," and he said the left, and he went into all the medical of what was going on, but there was deterioration. He said, "How could you call that?" And I said, "Well, listen, she could remember all the specific details of those scribbles that nobody else could see anything in, but it was still there." That's right brain stuff. And if you showed her something that the key to her room, she couldn't identify it because it wasn't something that she created. And anyway, I got the greatest respect, and I got more referrals from more people after that, because he had actually referred her because he didn't know what else to do. But he was always the most skeptical when I would come to the meetings and talk about where the patients were at or what they were doing and things. So anyway, back to what you're saying, for her to create the thing was satisfying at the time. To see it was even more satisfying. And the whole relationship between a person and their art is what it means to them. And this is why when a client will get very critical of themselves, and I say, I don't understand where that's coming from. And if they give you an explanation, it's always, well, I was told this, or in school I did this and I got teased about that, or whatever. And so, it's that relationship with, like I said, the brains, with the deepest parts of ourselves get touched the most deeply. And so those are the issues that I don't know that you can separate one from the other. It's just really, it's kind of the same, what do they call it? The
continuum.
Yin yang.
Yeah, kind of a continuum. And then I imagine their reaction to your feedback is kind of also therapeutic in and of itself. So there's a lot going on there. It's super fascinating. We're going to be talking about music therapy next week, specifically frequency and vibration and kind of that concept. But we got time for one more question, Rich. Why don't you?
Yeah, Virgil, if we had another hour, what would we be talking about? And don't take the whole hour, because
I can talk for an hour just about.
Yeah, we could all talk for, I would say this. You don't have to answer that, but I have a better one. It's more of an observation than a question. The three of us talking today, we all get the clients that nobody knows what to do about. And I think there's going to be more and more of those kinds of clients. It's almost like the ones that you can fix by giving a pill or by giving them, a book on cognitive therapy, they've kind of all been taken already. And it's kind of like what you talked about, the archaeology thing, that the other therapists have, sort of stepped on all the pots and broken them into little pieces. And our job is that those people need help, maybe more. And I briefly, you're out in Trauma Central right now, out in Sonoma County in California, where there's fires and you're locked down from COVID, and you know, I would say that you're going to be dealing with a lot of trauma coming up.
Oh,
And
certainly.
as a culture, what you have to offer and what we are trying to offer, I think is going to be more and more valuable as we go forward.
Certainly, because you know the air is yellow yet again today, and tastes like burnt fish as you walk around in the ashtray because the soot is so deep. But yeah, I mean, even on any given day, whatever is going on in the culture and in the neighborhood and in the person, their life, the family constellation, there's issues that present that are greater than the sum of all their parts. And so it's that one last thing, whatever it may be, and you meet them where they're at. And whatever the issue is that presents, that's what you have to deal with. This keeps coming to my mind. And so for whatever reason, I'm going to throw this story to you quick because I think it talks about what we're talking about. I was working with a group of schizophrenics. There were about 8 of them, and they all had a different identity that they were living with. A Vietnamese general, let's see, God, Mary, Jesus, I don't remember the other ones. Anyway, one day we sat down and they never got to the paper, right? They were just started something and the discussion was really starting to rage. And all of a sudden, the one guy says, "You're not God and you're not Jesus." And oh my God, they just all stood up and they were, and fortunately, as crazy as this is, but when we get in under another hour, I had finally convinced the nurses from past times, don't come running in just because they stand up or something, because it breaks. So I could see the nurses wanting to come breaking in, but they stayed outside and I didn't know what to do. So I just stayed seated, and the one woman sitting next to me who was just frightened hadn't stood up. I turned to her and quietly said, "If they don't sit down, I'm going to have to get up and walk on water." And she suddenly stood up and yelled, "Sit down. He's going to walk on water." It broke it. They sat down. "Can you walk on water?" And I said, "I don't know that I can, but I've read a book about somebody that they say did." And so we picked up the conversation again, and everybody was engaged. The nurses went back and sat down and had coffee. I think that's the best summation I can make for you. Just have to really know yourself and be able to understand where that person may be engaged at the moment with themselves and make the best way you can. And in that case, I certainly wasn't going to stand up and yell. We didn't need more people yelling in the room. And the woman that actually yelled, I don't think ever added anything to a session before or after that, because she was just so frightened. So anyway, it's engagement and sharing.
It's all fascinating stuff to me, to be able to connect in people in a ways like you said, when everyone else fails, and seeing the response to not only from the patient but colleagues and other healers and therapists. I mean, it's really fascinating what you do, and I appreciate you being here and taking time out of your busy schedule to rap with us on the Alt Psych Show, and look forward to having you back.
We have your website, and we'll put it up so people can contact you. You can work with people online, right? You can work online, right?
What's that?
If people want to work with you, they don't have to be right in your town. People can work with you online, isn't that right?
It's something that yeah, I'm sure you can manage anything.
If we could talk to you, I guess you could talk to a patient, huh?
We're doing it. We're living
proof. We do it all the time.
Yes. Yes,
All
and
right.
since you told me you could see those drawings, okay, I haven't done it yet, but I think it's probably something that you can work through anything. Believe me.
Well, if healing's the intention, then healing occurs. So thanks again, Virgil. Everyone check for a link to the website and join us next week. We're gonna have Debbie Stern and be talking about music therapy and frequencies and vibrations and lots of cool stuff. So until then, remember everyone,
Be well. Thanks,
Thank
Virgil. Good to see
Thank
you,
you.
brother. All right. Bye-bye.